Hello and welcome to our 2023 CISM Live series, where we discuss a variety of crisis intervention topics, interview organizations that help crisis responders, and share resources in crisis response. My name is Kelly with the ICISF, and I'll be your host for today's interview. Today, we're joined by guest speakers, Andrea Herring and John Hunt from Crisis Response Canines, to learn more about their organization and their canines. Andrea Herring, co-founder and CEO of Crisis Response Canines, has been actively involved in training and participating on therapy dog teams for over 10 years. She is a certified tester and observer for the Alliance of Therapy Dogs, Canine Body Language instructor, AKC Canine Good Citizen Evaluator, and disaster relief crisis counselor. John Hunt, who's the co-founder and COO of Crisis Response Canines, is a 27-year veteran of the New Jersey State Police, where he achieved the rank of Major. John was the Homeland Security Special Operations Section commanding officer. John also served as the Deputy Director of the New Jersey Officer of Emergency Management, and recently served as the Corporate Director of Security and Emergency Management for the AtlantiCare Health System. Welcome, Andrea and John.
Hey, Kelly, we appreciate the opportunity, and most certainly we're grateful to ICISF for the opportunity to speak. And to your entire audience, thank you for participating in this program.
Well, we're happy to have you. Today, we're actually going to take some time and talk about what Crisis Response Canine does and what sort of canines you work with on a regular basis. So if you guys could please tell me a little bit about Crisis Response Canines and how your organization got started.
If I could, before we even talk about the organization, I think it's important, and I've said this to many ICISF classes that I've taken, and even with Dr. Everly himself, I think it's important that the folks out there realize, at least in my case, one of the main reasons I even started was back after 9/11, I was serving in the state police, and because of the events that unfolded, a number of the commanding officers were voluntold to take an employee assistance program class. Did so, quite frankly, a lot of us were just going through the motions. And it wasn't until, not too long after serving as the major in the operations branch that one of our folks unfortunately took his own life. And we started realizing we need to really start focusing on different things that were ongoing with our own personnel, first responders, suffering from traumatic events, how they were, impacted by cumulative events. And again, that's where I really started to focus on, the ICISF, the CISM, the SAFER model, some of the things attributed to, ICISF and what we do. With that said, I will tell you that I was doing some studies, and I started looking at the role that canines were playing from a therapy standpoint, just a mere therapy. And we'll actually discern that a little more as we progress. But as I was going forward and I was showing my dog, someone asked me to consider looking at the therapy aspect of canines. It was then that I ended up meeting in 2014, Andrea Herring, who had started to move forward with a program that was going to really focus on first responders and how a program incorporating canines could really focus in on their well-being and trying to help them. We started right then and there back in 2014, Andrea and I looking at a model of critical illness stress management and animal-assisted crisis response. And quite frankly, that's where the whole, crisis canine, started from that point. We really saw a great resolve in 2015 when we went to Pulse. And from that point on, I can tell you that we've seen a number of things grow with crisis response in that regard and how we continue. Andrea, you want to add anything to the whole model of crisis response?
No, we saw from the beginning that they were starting to ask us to put our therapy dogs in more complex environments. Mm-hmm. And we realized that it was not just the training on the dog, that our handlers needed additional training as well. So that's where we started researching and kind of coming up with appropriate training for our handlers to be able to handle those more complex and unpredictable environments.
Well, that's actually a great segue into my next question, which is, who are your handlers and what is training like?
Our handlers come from a myriad and diverse backgrounds. Currently, right now, I would say we're close to 18 states in the country. I would say we're probably around 64 canine handlers and canines. And again, they're all at this point volunteers. These are all volunteers who thought enough that they wanted to look out for the well-being, mostly of first responders. As Andrea touched upon, even when we went to Pulse and as we've progressed, even now we have people who deployed to Michigan State University. Now we have people all walks of life who are going out there. One of the people who are the Michigan State deployment is a psychologist who has taken the time actually to get her dog trained and certified as a crisis response dog. And again, we're going to go into the different categorizations of dogs in a little bit. But again, we have psychologists, we have former law enforcement, we have a lot of healthcare workers, we have general folks who, again, have taken the time to get their certification through ICISF and some of the CISM courses to make sure they're sound in the approach when we have an event that they can go forward and they can actually interact with people who may need them. With that said, there's expansive training. First, for our handlers, you have to have a number of incident command courses from FEMA, the independent study. There's a lot of things that we mandate for our people, from a mental health first aid, if you will, psychological first aid. And again, it goes back to the whole premise of CISM that started with Dr. Everly and Dr. Mitchell in the 80s. And now we focus on specifically that folks have to have at least the basic training to have a good comprehension and understanding. And as we go out and deploy, then we have more graduated people who will be with them as well. But everyone has to go through that from a handler standpoint. Now, that's just their background, understanding the role that they may play in an event. Then they have training as it's applied to the canines themselves. The canines go through far greater training. Everybody always wants to say you have therapy dogs, and that's problematic. Honestly, anymore, when we go out to different events, we see it firsthand. We hear it a lot where people have a therapy dog. And quite frankly, that's wonderful. There's great therapy organizations out there. They're phenomenal. We interact with them often. Our dogs go through far more extensive training from a standpoint of environment, of how to interact with people. And then our higher dogs have achieved a working service dog. And again, something I want to really focus on now, and you may ask more poignantly later, is what's the difference between a therapy, crisis response, and a working service dog? Well, a therapy dog is like a comfort dog, and that's what we call our dogs. We don't even call them therapy dogs. They are going to be the canines that go to schools, hospitals, and the like. And certainly that is the foundation for all we do, because we want to make sure that dogs are used to diverse environments, interacting with all sorts of individuals. From crisis response, we go into far greater training. The environment is far more challenging. From a standpoint, we may go into environments where there's broken glass, they're working on poor surfaces. We deployed to Surfside. It was very important that those dogs, every one of the 6 that deployed, understood the environment. Now you're going to be meeting with different people. I will say, when it's asked of me, when I go to different presentations, what's the biggest difference between a service dog or a guide dog and what we're talking about from a crisis response working service dog, the certification that we achieve? And it's simply this. Obviously, a service dog is meant for a specific task. Perhaps it's a task associated with someone who may be suffering seizures and they're there to alert them, or someone who may have sight impairment. So there's a specific task for a specific person. What we've trained our dogs is from a standpoint of tactile distraction and pressure point, and that is for mostly PTSD. That's what people want to associate it with. The biggest difference is we train our dogs with that certification, if you will, that training, but our dogs have to be open to multiple people, different environments and multiple individuals. And that's specifically how we train our dogs. It was never clearer than in Uvalde when we were interacting with the children. And again, knowing the amount of emotional people that we were impacting, those dogs were surrounded by many, not just one. So that's the biggest thing that people always ask us. Even Dr. Everly asked me when I went through the instructor training, tell me in the class, what's the biggest difference? And again, I was fortunate enough at the time that I had my working service dog, Axel, with me, and people saw firsthand how he sits, how he interacts, and what he does with a group of people rather than an individual. But our dogs, as you mentioned, Andrea takes them through a litany of training. They have to have canine good citizen. They have to have all superior obedience. And then they graduate into different levels if they want to go into the crisis response canine certification. And then the working service dog, again, that's an independent group. There's 2 trainers, one from Pennsylvania, one from New Jersey, that have to assess the dogs, and that's the only way they can actually achieve that certification. So it's outside, and there's integrity to the program and obviously the training aspect of the canines.
So let's dive a little deeper then with regards to the canines specifically. What breeds of dogs do you guys have within your organization? What does their training entail typically? And, you know, maybe expand upon how is it different from a therapy or service dog?
So the dogs that we have in our organization, they range from our small dogs, which could be as small as a dachshund, to as large as a Great Dane. We do not breed discriminate. We have all sorts of breeds, mixes. They come from a variety of backgrounds, whether from breeders or shelters. So we don't breed discriminate. It's very important that you do have a wide range of canines available because certain people relate to different types of dogs differently. So when we are on a deployment, it's really nice when we have a variety of dogs because sometimes a big dog may be more appropriate, or if a child or somebody is afraid of a canine, that the smaller dog, you know, is less intimidating than a larger dog. So that we do have a minimum age, and that's because of their certification and their maturity level. So a dog cannot be, they have to be 1 year old in order to be a therapy dog. And then to achieve a working service dog certification, that's an additional year on top of that. So the minimum age a dog could be is 2 years old. With that said, it depends on the dog and their temperament and their personality of how much training or how much they need to mature to get to that point of the working service dog. So those are just age minimums. We have no cap on the other end of how old the dog. We don't retire them at a certain age. If they are still happy and they are still enjoying their work and they're able to do it, the dog can continue to work for as long as the dog chooses to, because the handler is the dog's #1 advocate. So it is very important for our handlers to be able to recognize that if at any point our dogs are showing stress signs, behavior changes, or anything like that, we need to get to the bottom of it and understand if the dog still wants to do the work, if they don't want to do the work, is it a medical condition going on? We are on deployments. We as a team, we look out for each other's canines because the dogs are working. They didn't volunteer to do this. We did. So we are their #1 advocate. And as it goes to training, we do have the comfort dogs. And under that, we call animal assisted activities and animal assisted therapy when you're looking at the whole animal assisted interventions. So those two are there. Those teams, you know, they go to very predictable environments. You know, they're set structured visits. So their training is basic obedience, then their therapy dog tests. Additionally, when our dogs are going to the crisis response level, as John spoke about earlier, there's a lot more training that goes involved. It is advanced obedience training. There are public access tests. There are how the dog responds to those stressful environments. Can the dog recover if they are stressed out? Do they properly display stress signals? And can the handler read those as well? Because that's very important. So those dogs go through much more training. We recertify them annually to make sure that they are still able to perform those tasks. And then our highest level of dog, which is in that category of animal assisted crisis response, is they are task trained, and they are to be able to perform those tasks verbally or on instinct when they are working with individuals.
Wow, it sounds like that's very thorough and well thought out. So that's amazing that you guys do that and actually go through that process. So do you all partner with mental health professionals within your organization?
Absolutely. As I indicated, it was actually very nice during the Michigan State University deployment. For those who are familiar with Michelle from ICISF, she actually, because of the strategic partnership that CRC has formed with ICISF, they actually immediately knew that we had deployed. We started our deployment. Unfortunately, the event occurred sometime around 8:30ish at night. And by 2:30 in the morning, we were already set up with 3 teams from Ohio and our Michigan team to deploy. In addition to that, Michelle reached out to me and actually gave me a liaison from ICISF that would help us in that capacity from a standpoint of CISM. With that said, we have somebody, as I mentioned before, who is a psychologist who's part of that team. But on a regular basis, we have folks who are part of our organization. I'm certainly hoping some of the people who are part of your audience today will consider joining us, or at least consider helping us as we go out to these different events. But most certainly, we have our own our own core group of individuals. But with that said, when we went down, good example again is, I'll say, Uvalde. We went down there, we worked with the authorities from Texas, and they actually had us working directly with people from the mental health background, so that when we were interacting with anyone, whether it was the community people, certainly the children and the first responders, who were impacted, so that again, if we're there and we're moving forward and we're doing the appropriate diffusing or debriefing, again, at least we had someone who had that level of expertise that could actually assist those individuals towards that bridge of recovery.
So then how do you choose your response locations when you guys?
Well, again, it's ironic you say that. I think the better way of putting it is, quite frankly, they choose us. In the early stages, we never ad hoc. For those who are out there, they know what that means. You just don't respond to things, because then you become a burden on what the event may be. But even when we, as far back as Pulse, more recently with Michigan, the Michigan State University, we're in constant, as I said to you, because of my background in emergency management with incident command, immediately we respond with folks who are incident commanders, associated with the event, or working with the state emergency management office. And we tell them the resources we have. But the last couple of years, folks actually reach out to us. And again, I give great credit to the people of ICISF, because they're aware of what we've done through me and Andrea and many of our folks have gone through this, and they hear what we do. And we are actually reached out from ICISF. They have connections with emergency management. So again, depending upon the event, we will respond if we have the assets available and the appropriate assets available. I'm talking about canines, and we want to make sure we are sending the appropriate handlers. We are not going to send a comfort dog to something that occurred in Michigan, Michigan State University or Uvalde. We are going to send our best working dogs and those people who have the background and skill set, so that they're able to work with some of the people who are in the behavioral health issues. Because again, we want to focus on the same core principles of the physical, the cognitive, the emotional, and the behavioral, the core, elements of CISM as it applies to ICISF. So again, we want to make sure we're working with the appropriate people who can guide us accordingly as we continue to progress with the individuals that we're going to be impacted.
So that brings me to an interesting question that I have for you all. So when not on deployment, what do your teams do?
So we encourage our teams to work in the communities, because while there's not maybe a large scale incident going on, there are still events that happen daily, whether it's with our healthcare workers in our school districts, at the dispatch center. So our teams are out there supporting our communities and our first responders on a daily basis. In addition, it helps our dogs stay in working condition. We want our dogs to perform at their best at all times. So this keeps them in the routine also of working and how to comfort people. And you do notice that if a dog just kind of shows up here and there, they're not as sharp as our dogs are that are working on a daily basis.
If I could add to that too, if you don't mind, it's funny, we've been asked time and time again, nationwide, people, and I'll say schools and even some first responders, fire, even some police stations, they want to have their own dog. We were working with a hospital recently who wanted their own canine. Sometimes, and I'm going to ask Andrea to comment on this as well in a second, because we have found that to be problematic, quite frankly. And in one case, we try to help, I'm just using this as an example. We tried to help one fire station have their own canine. The individual was only surrounded by certain individuals in a certain environment, and it became overly protective and aggressive. And again, I'll even go back to another step that Andrea spoke of, and I'm glad she brought it up. We have been compared to other organizations who have similar canines. And as Andrea so aptly put, they will go out and they will respond accordingly. I'm not going to use the organization because it was a unique confrontation almost that we had with them, because they were like, hey, we would like you to assist with our dogs, and here their dogs were not being utilized properly. And the reason was because they're only going out periodically. Whereas Andrea said that not only do we obviously go to deployments when appropriate, when requested, But again, every single day, I will say my dog alone this week alone will do anywhere from 5 to 6 details, not deployed, but doing other things, whether it's hospital, have gone out actually to a police debriefing, have gone to a hospital debriefing. So again, we're doing on a regular basis so that when we have the opportunity to go out, our dogs are far more advanced because honestly, they're more professional about what their role is. So we found that, and Andrea, I'm going to ask you to, if you would comment on specific environments having their own dog and some of the things we have seen from our training.
Yeah, so when there's generally a facility dog, the training gets a little relaxed. The dogs are a little more protective of their environment. Where our dogs, we do make sure that they are task trained every day. They can handle any environment. They can handle any strange dog that walks into any type of person that walks in. Sometimes when the dogs are familiar with people and then they see a strange dog, they become protective. So we are seeing, as facilities do want dogs, it does become problematic if they are not working that dog in other locations as well.
Well, it's good to know that your canines are actually pretty much on duty all year round, regardless of deployments or, critical incidents that may come up, because, that's additional training that they're receiving, all the time, which kind of sets your organization apart, I think, from most.
And I will add that they like it. Our dogs like what they do. It's not that we're making them do it. They get excited when they see their vest. They want to go out and work. They enjoy meeting people. So it's not us making them do it. They actually really do enjoy their job.
Yeah, I think it's worth saying that, time and time again, we've had teams, or we've had, handler and a canine come in, and unfortunately, they were unable to perform in the manner that was necessary. And I think that, again, lends to what Andrea was just saying, that people will ask us, is there a specific breed or is there a specific thing? Well, a lot of times, I take a great deal of time to research the temperament, the obedience capability before I would even think to acquire a canine. And that's whether it's a full bred, whether it's a rescue. So again, unfortunately, we've had times where people couldn't do that. The nice thing about it is that people want to participate and they end up becoming a part of our support team. And that's extremely important to us for those who go out. During Michigan State, during Uvalde, we take an extra individual with us who is there, if you will, from an administrative standpoint. They're there to facilitate some of the things that are ongoing so that the canines, and the handlers obviously can focus on the chore at hand.
So what has the response or reception been like when you guys have actually been on deployment to a critical incident or even visit a facility or department or agency?
It's been overwhelmingly positive. I'm actually amazed. It's funny. I will tell a brief story, if you will. I remember when I was the major in the state police, I had the privilege and honor of overseeing and commanding 600 people from New Jersey who went down to Katrina. And during that time, there was a mistrust of law enforcement, of authorities, and we were struggling with interacting with people. And the state of New Jersey actually took over districts 1, 2, and 6 in New Orleans for a time. And again, we were not communicating well with the community. And at one point in time, they brought in comfort dogs, therapy dogs, and all of a sudden you could see barriers were broken down and people started speaking. The same thing has existed when we've gone to these different events, and we've mentioned a couple. We've, whether it was Las Vegas, whether it was South Sutherland, Texas, whether it was Virginia, Parkland, certainly, and I know this, Kelly, and ICISF is quite aware of all the places we've been. Originally, it was done for first responders. That was our main focus, and it was the first responders who said, "Hey, would you mind helping with the community?" Certainly, part of the community was those in healthcare that were impacted. In Virginia Beach, the dispatch center was right across the street. A lot of people forget about the communication operators who pick up that phone and don't know what's on the other end and the stress that they go through on a regular basis, let alone during, a significant traumatic event. So again, it's been overwhelming, the support we've gotten from others and how often we've been communicating with people who have needed, our services and have benefited greatly from the canines. And a perfect example, again, is Uvalde, when we had, I'll use one example that I've used many times over. We had one young boy who was significantly impacted by the events and was not communicated at all. And they asked if I would try to communicate, interact with him so he would communicate. And it was ironic because I allowed him to take the dog, and I allowed him to introduce him to a number of other students who were, part of classroom 111, 112, part of the Uvalde school system, the Robb Elementary School system. And he became a stakeholder. And all of a sudden, he started communicating more with me and communicating with the kids, to the point where it was actually ironic, because at one point in time, the professional who had asked me to try to interact with him came back and said, hey, how are you making out with that young boy? And I said, remember that young boy that wouldn't talk? And he goes, yeah. I said, guess what? He won't be quiet now. He was so comfortable. He felt so comfortable around Axel, and you could just see the barrier had melted down. He was, he was decompressed. He felt easier to speak to at that point. And the great thing about canines that sometimes people forget, and I've had these one-on-one conversations with some of our ICIS people, is, with us, sometimes people think there's a preconceived thought process. There is none with dogs. They don't care who you are. They don't care what race, ethnicity, religion, gender. Canines are there for you. And again, that's what's the best part about that. And people see that. So again, it's been an overwhelmingly positive response, to the point where we've gone back. Uvalde has already asked us. Some of the people down there have asked us to come back. Certainly, they're going to have a one-year memorial, and they want to see us because they want to continue with that bridge, or that road to recovery, if you will. And again, I'm glad that our organization has thought of in that capacity, whether it's a standpoint of the initial response and helping people, or as they progress through their time.
Well, and I'm sure as a handler, from the handler side of things too, seeing the impact that you guys are constantly bringing forth with regards to the areas that you respond to are beneficial as well, and positive. So that's awesome. So what do you do for the mental health of the canine handlers themselves? As you spoke to, they obviously witness and take on a lot of grief and trauma, when they respond to critical incidences. So how do you help those individuals?
When they come back, we do partner with mental health professionals that will lead them in their own debriefing process. We have those people available for them. We also check in with our members to make sure that they are okay. In addition, when we are on deployment, we are a team. So we do have the privilege of working with each other on a daily basis. So we can identify each other's baselines, and we can identify if we notice one of our team members is starting to struggle with something that they've been experiencing. So we can help them get the proper help that they may need from the response that we just had. Do you have?
I do. Like I said to you, at Michigan State University, we have a psychologist who's with them on board. We are part of 2 studies right now. Actually, this evening, I will be going to a healthcare system in New Jersey. We're part of a review that they're doing, a study on not only the individual, me, and other of our handlers, but the canine as well, and specifically seeing how they are progressing. I think Andrea touched on it earlier, how we progress. As much as there's not a cap at the end, the annual testing and making sure that the dog is sound in their approach and all that they're doing. So again, it's something we have to do on a regular basis. And quite frankly, we have Vincent is available through us through ICISF. Other people have used his services. Again, we know that. I have another instructor up here in New Jersey, Sandy Lynch, who immediately will respond to us, and we'll talk to her about where we are. And as we go through, it's nice, like I said to you, several of us are going forward. Some of us have achieved our instructor status. We have others that are going through that. So again, we're able to gauge the own response. And again, I think it's important to go back to the physical, cognitive, emotional, behavioral, because those are the same tenets we're looking at in our own individuals, let alone the people we may be going forward and doing a debriefing. So it applies to everyone, whether it's the people we're helping or our own team that is going out to help.
Well, then I've only got one question left to ask you guys. How can people learn more about Crisis Response Canines, join, contribute, ask for a visit? How can we reach you?
So we're very active on Facebook, and we can be found at Crisis Canines, all spelled out. And then our website is also crisiscanines.org.
That's wonderful. And we'll make sure to link all of those links in our description of this video, so that way you guys can actually learn more about them. Thank you.
Kelly, if I could, just one quick thing. I can't begin to tell you how many times I've taken classes, especially we just had one down in Baltimore, and the incredible response I got from my own classmates, going through the program, and how many times people from ICISF have aided us, have supported us. So again, I'd be remiss if I didn't shout out to the organization and to the people who are probably, I'm hoping, are listening to this program. A direct thank you to all you folks, because it has truly aided us as we continue to expand across the nation with what we're doing. And the CISM, the CISM, and the Animal Assisted Crisis Response Model is something that we certainly are proud of. And I know that in talking with Rick, the president of ICISF, something that we're certainly exploring, not only continuing to explore nationally, but we're looking at what we can do internationally to talk about marrying the two together and how it really aids people who may be in need.
Well, you're very welcome. I know both Rick, our CEO, as well as the board members and all of ICISF staff are very thankful that you guys are an ICISF strategic partner. So we're happy to have you guys.
Well, thanks again for the opportunity today, and again, hopefully we'll have some good interaction with some of the folks as we have throughout the day with the program. And I'm sure in the future we'll continue to serve.
Mm-hmm. For sure. Well, I just want to say thank you again, both Andrea and John, for joining me today to discuss the crisis response canines. Now, if you, the viewer, have enjoyed our interview today and want to learn more about Andrea and John or the organization, they've actually put together a free PDF for you to download and share with your coworkers, peers, and even team members. You can let us know in the comments below if you find these resources helpful and what other resource topics you would like to see. You can visit Crisis Response Canines at their website at crisiscanines.org, and we'll make sure to link that in the description as well. You can also listen to a presentation from Crisis Response Canines at the upcoming World Congress 17, The Power of Purpose. You can learn more about their presentation and others by visiting ICISFworldcongress.org. Are you guys looking for additional information? Crisis Response Canines recently published an article in the ICISF Crisis, Stress, and Human Resilience Journal. You can read the entire article and more with the link in the description. And some exciting news. Our upcoming member-only newsletter, LifeNet, has a brand new article from Crisis Response Canines that will be published in March of 2023. To have access to the article and become an ICISF member, visit the link in the description and sign up today. New this year for all of our upcoming CISM Live series, we now have a podcast series where you can listen to all of podcasts. You can listen to content only released on our podcast platforms or catch up on other relevant interviews, such as our CISM Live series. To learn more about this, visit icisf.org/podcasts. You can follow us on social media for more CISM related news, articles, and learn more about all of our upcoming trainings. If you like today's discussion, be sure to give this video a thumbs up on YouTube or subscribe to our podcast channels to be notified when we post more content. If you know of anyone that you think would be a great fit for the CISM Live series interview, scan the QR code above here and actually send me an email. Until the next interview, remain safe and healthy.